Sciatica. It's a pain in the bum, and often down the back of the leg and in the lower back, and sometimes even in the foot. And that pain can be a shooting pain, it can be a burning pain, it can even be a lack of sensation, numbness, pins and needles. Generally something that people really suffer with when they've got it. So what is sciatica exactly? Well, it's a bit of an umbrella term for any sort of condition that compresses the sciatic nerve and creates symptoms all the way down the pathway of the sciatic nerve. The nerve itself comes out in many different parts, from the bottom of the fourth vertebrae here, fifth, and then all the way down the first, second and third sacral foramen of the sacrum. And those separate strands come out and form quite a big thick nerve that then passes through the pelvis, down the back of the leg, before branching out again when you get down to the calf. So the symptoms can span that whole pathway between the lower back and the feet. So what causes sciatica? Well, there's loads of different reasons that sciatica can occur. One of the more common reasons is if there is some sort of compression on the intervertebral disc. So we have these spongy discs in between each of our vertebrae, and if we have lots of downward compression in the lower back area, those discs can get squashed and they bulge out of the side, compressing this nerve root around the side of the spine. An example for this is what a nice healthy intervertebral disc should do: act as suspension support for the rest of the spine. Problem is, if it gets compressed too much, we end up with a bulge out of the side of the disc, and that then compresses the nerve. Other reasons include piriformis syndrome, and piriformis syndrome is related to the piriformis muscle, which attaches to the edge of the sacrum here and into the side of the femur over here and spans this area. Now, that muscle pathway actually crosses where the sciatic nerve runs. So when that muscle gets tight, it can press on the sciatic nerve. And actually, in a certain proportion of people, around about 20%, the sciatic nerve actually runs through that muscle, making it more likely for you to suffer with sciatica through piriformis syndrome. There's other reasons that the sciatica can occur. Sometimes when the hamstrings that attach into this area here, if they get really tight and they're inflamed, you can get what's called tendinopathy, where the tendons thicken, and that can also irritate the sciatic nerve. Or there is a condition called spinal stenosis, where the actual spinal canal where the spinal column runs through actually narrows, and the facet joints at the side of the spine where these nerves exit can narrow as well and just pinch on the nerve. So what do we do about this? Because it can be quite a debilitating issue. There's various forms of exercise that can help. Something that I do is acupuncture, which is really helpful for something like sciatica, because we're not compressing the area, we're not irritating the nerve, we're popping the needle in, leaving it for a while, allowing that soft tissue to recover. And it's worth noting that with a lot of the therapies, the issue that you're trying to solve is all of the soft tissue, the muscles that have clamped around to protect the area, to release them off to allow that disc to decompress. Acupuncture is also great for inflammation, and there's also quite a lot of inflammation involved in sciatica symptoms. And general pain relief can be quite helpful as well. I also do massage, and that can be quite helpful for sciatica as well, though there is more compression involved and more movement, so sometimes do tend to try and avoid it because it does end up irritating the situation. So they're the things that I do. They can be really effective for sciatica. Obviously, each case is totally different, and each person will need different methods and different techniques to solve their sciatica. But hopefully that gives you a bit of an insight into exactly what sciatica is and how we go about solving it. If you're more interested in some further detail on this topic, I do have a blog post, which I'll put in the description, which gives you much more detailed aspects of exactly what sciatica is, and also the treatments and the treatment plans that you can offer patients if you are a practitioner yourself. So go and check that out if you're interested. Thanks. Bye.